Hello, I'm Noha Shalabi. I'm with the Neuroengineering and Pain Research Lab at the University of Connecticut under the supervision of Dr. Bin Feng. Today in this video, I'd like to talk more about chronic pain. We mentioned in the previous video that there were two types of pain, acute and chronic. Acute pain is the kind that goes away once we're no longer ill or the injury heals. It's also called nociceptive pain. Chronic pain is the kind that lasts long after we've healed and can either be inflammatory nociceptive or neuropathic. Let's look closer at each of these types and understand the differences between them. First off, acute or nociceptive pain. We defined acute pain as a sharp, sudden pain where the sensation varies depending on intensity, quality, or duration of the stimulus. It acts as a warning to avoid or minimize physical damage and forces rest so the injured tissue can heal. Some examples of acute pain are stubbing your toe, bruises, cuts, twisted ankle, post-surgery pain, and so on. The pain could be gone in a few seconds, or it could take up to 2 or 3 months to heal. If it stays over 3 months, then it's no longer acute nociceptive pain. Inflammatory nociceptive pain is a type of chronic pain that comes from the prolonged exposure of nerves to inflammatory factors. Inflammatory factors are chemicals that help the tissues heal, so when we get injured, inflammatory factors are produced at the site of injury and cause inflammation. And as you have probably experienced before, the site of inflammation becomes overly sensitive, so that even non-painful stimuli become painful. That's normal and okay for a short while, but it becomes a problem if the nerves are exposed to these sensitizing agents for a long period of time. This can cause them to remain overly sensitive even after the tissue heals. The fact that there are many different types of sensitizers all working together makes them difficult to target as a way to prevent that from happening. The third type of pain I'll talk about today is called neuropathic pain, and it's also a type of chronic pain. It's produced by damage to the neurons themselves in the peripheral nervous system, which are the nerves that we have all over our body, in the limbs and in organs, or the central nervous system, which are the nerves in the brain and spinal cord. Neuropathic pain can come from both peripheral and central sensitization mechanisms. Peripheral sensitization is when the peripheral nociceptors amplify and unnecessarily exaggerate the pain signals sent to the central nervous system, which is the spinal cord and brain. Central sensitization is due to the overexcitability of the spinal cord neurons, causing them to send increased pain signals to the brain. These are mechanisms by which acute pain can transition to chronic pain. So inflammatory and neuropathic are both types of chronic pain, but chronic pain can result from both components. Inflammatory pain can cause damage to the neurons, which leads to neuropathic pain, and neuron damage can cause inflammation, leading to inflammatory pain. There's an unfortunate paradox in that with most parts of the body, when they are damaged, they stop working, shut down. But when nerves are damaged, they do the opposite. They switch on and sometimes won't switch off. Another big problem that can occur and cause chronic pain is neuroplasticity. It's when persistent acute pain can actually cause the nervous system to physically remodel and change its architecture. For instance, this nagging persistent pain can lead to the death of interneurons in the spinal cords. And interneurons are very useful to have since they release inhibitory transmitters so they can ease and lessen your perception of the pain. Moreover, we have these junctions or spaces between neurons through which they communicate called neuronal synapses. And the cool thing about them is that they can change and adapt, which helps us learn and develop skills. But when they are constantly bombarded with pain signals, they can remodel to intensify pain signal transmission, causing neurons to become more sensitive, they act more aggressively to stimuli, and even grow more connections to the central nervous system to transmit the pain signals. So to prevent neuroplasticity and chronic pain, it's very important to treat acute pain as early as possible, so as not to give the nervous system a chance to change its architecture. So let's regroup. What's chronic pain? As we've said, it's pain that persists beyond the normal tissue healing time of 2 to 3 months. It can range from mild to severe, it can be constant or come and go, and it cannot be explained by pathological factors. The tissue has healed, the disease has been cured. So it's not a symptom, it's actually a disease in its own right. And unlike acute pain, it serves no purpose. It's more like cancer, it's a system gone wrong. A lot of factors can contribute to the risk of a person to develop chronic pain. For example, older people are more likely to develop chronic pain than younger people. Females are more likely to experience chronic pain. Higher rates have been reported in minorities and people who are socioeconomically deprived. Lifestyle, of course, can have a direct relationship with chronic pain because it can affect how strong and healthy the body is. Whether the patient is a smoker, how much alcohol they consume, how often they exercise, the kind of food they eat, how often they're exposed to sunlight, and so on. Clinical health is obviously a great risk factor for chronic pain. Someone who's been sick or injured or had surgery, they're at risk of their acute pain turning chronic. Mental health disorders, stress, and genetics have been found to be contributors to chronic pain development. Even personal beliefs and attitudes can affect the likelihood of developing long-term pain. For example, having active lifestyles rather than adopting passive coping strategies, such as just resting and taking medications, can reduce the level of pain and impact the quality of life. People who have experienced emotional or physical trauma in childhood have a higher risk of chronic pain in their adult lives. People who have experienced personal violence or abusive relationships were found to be more likely to experience subsequent chronic pain. A lot of factors associated with chronic pain can be both a cause and an effect. We already mentioned how some factors can lead to chronic pain. Many of these factors can also be caused by chronic pain. People in constant pain can have difficulty staying active and exercising, causing them to gain weight. They might indulge in overeating or drinking or smoking as a form of release from their pain. Their pain might cause them to become stressed and depressed and might affect their sleep. So unfortunately, it can easily turn into a vicious cycle that's hard to break. Chronic pain is a major societal problem. It's estimated to affect about 7 to 55% of the world's population. 30% of adults in the United States have some form of acute or chronic pain, and it affects more than 40% of the elderly population. On top of the healthcare costs, there's also the lost productivity, disability programs, and unemployment that make this disease have an annual cost of $560 to $635 billion. That's more than heart disease, cancer, and diabetes. And it's the causal factor for the current prescription opioid abuse problem that we will address in more detail in the next video. Thank you so much for listening, and I hope you learned something today.